Good afternoon. Thank you very much for the invitation. This is a very important event for cancer patients and stakeholders. I'm going to present one of the activities of my department, the development of survivorship clinic, which is the first survivorship clinic in Greece. I am professor and chairman of Attikon University Hospital, and we are building a new cancer center there. I did my training at Yale University, where I was a professor, and I'm trying to introduce new ideas and new concepts to my department, aiming to meet the international standards of cancer care. So we developed, what about the survivors? We know that the treatment of cancer has made substantial improvements, and a substantial subset of the population, of the cancer patients, is cured with novel treatments. So now, with the novel therapies, immunotherapies and targeted therapies, a substantial percentage of patients, even at metastatic stage, survive the disease. So how do we define the survivor? The survivor is every patient who is diagnosed with cancer at the time of diagnosis. So every new cancer patient is considered a survivor. And we have made improvements in cure rates. However, improvements in survival should be accompanied by improvement in quality of life, because it's the quality of life which matters most. Many patients survive the cancer but suffer, so we are trying to minimize the side effects of treatment, the long-term toxicity, but also the disabilities associated with cancer itself. So, since cancer treatment has made significant steps, now a new issue in our care is how to deal with the survivors and their quality of life. And in international centers, several cancer centers have developed survivorship clinics. Of course, they have been ahead of us. It's when I went in 2013 in Australia to give a lecture at Peter MacCallum Cancer Center in Melbourne, there was Olivia Newton-John Center, a spa, where patients could do yoga, get advice regarding nutrition, sleep quality, smoking cessation, and all these issues that are very important, and the psychosocial issues associated with the treatment. We were far behind at the time, but now I think we are very close to develop a state-of-the-art survivorship clinic in Greece. And we see across the globe several cancer centers, and psychosocial support is a big issue in cancer care. We see that cancer centers such as Royal Marsden, for example, had developed even beauty clinics that they give beauty advice makeup advice and everything to the patients. And we hosted a makeup event in my department in collaboration with Sephora regarding skin care and makeup advice. And the patients who attended the seminar were very happy with that. We built the first survivorship clinic in Greece. You know, our patients were very happy with this initiative. So how this clinic works, we book an appointment with the patient, and this is the team. You know, I'm the chair of the department, and Dr. Kalaidzi is a physician specialized in physical medicine and rehabilitation. She is specialized, is the president of the Greek Society, the Hellenic Society of Lifestyle Medicine. So Poppy brought this initiative to my department. She has been educated in lifestyle medicine at Harvard University. She did her residency at Charité in Germany, where the survivorship is, you know, a focus of cancer care, a major focus of cancer care. And you know, she developed the program, the algorithm of the evaluation. And we have 6 very important assessments. So the patient is getting an interview at the first appointment and an evaluation regarding physical activity, nutrition, psychosocial needs, quality of sleep, addiction, and you know, social issues or toxicity associated with the treatment, such as cardiotoxicity. We have cardio-oncology section in my hospital, and with
I'll have to ask you to accelerate a little bit.
Yeah, with European funding, and also the assessment of the risk of secondary cancers. And then the patient is referred to all these subspecialties of our network, and then receives a report on the needs and the appointments that are needed to improve all these aspects of the quality of life. There are 6 weeks intensive sessions. Of course, everything begins from the patient and the need and the decision to make a change in his or her life. So this is the concept, and the challenge is to build on this program and disseminate the program in different areas of Greece, because we need to build a network, not just one program. And the Ministry of Health is very much interested in this context, and we have industry support. This is a summary of our program. Thank you for the opportunity to present briefly our initiative.